Today we have with us Dr. Srinivasa, CEO for Apollo Medskills. At Apollo Medskills, he is the primary driving force behind building businesses, re-engineering processes, and developing productive sourcing relationships across the globe. With over 20 years of experience in hospital management, medical education, and healthcare skilling, he is heading the largest healthcare skilling organization in Asia. Dr. Srinivasa, it's an absolute pleasure to have you with us today.
It's equally a pleasure. Thank you, Yamini.
Thank you, sir. So just to begin with, sir, we want to understand your personal background and what led you to the healthcare sector.
Yamini, that's an interesting question. Actually, I'm a physician by education. I did my medicine in the year 2002. And following that, I was practicing medicine. I was working for Apollo Hospitals Group in their emergency medicine department in the ER. And then I had got an education opportunity in UK, so I had a brief stint in UK doing a specialization in internal medicine. And after that, I came back. I was practicing as a physician, and later I have done a executive management program in healthcare. I had always an inclination towards leadership. And I always wanted to lead some healthcare organizations. So that's the reason I wanted to brush up my knowledge on healthcare management and joined ISB. And after my stint in ISB, I worked for various global corporate chains. I worked for Siemens Healthcare. I worked for a medical device company called Space Labs Healthcare in their product validation division. Then I joined Apollo back in 2007, leading their clinical testing division for a group called Apollo Health Street. Then I got into education in 2009. From 2009 onwards, I am in health education and medical education space. I've joined Apollo Knowledge, one of the group companies called Medskills. It's a medical e-learning company. Okay. And it's been 5 years that I'm associated in healthcare skilling. So I'm part and parcel of the Skill India movement, started by the government of India. And really a pleasure working with various ministries and being a part of Skill India movement since its inception. So that's briefly about my background, Yamini. Thank you.
That's great. Now I want to ask you, what prompted the shift from being a practitioner to going into education? What prompted that shift?
So I was actually always interested in teaching. So that's one of my passion. Teaching was always my passion. So while practicing medicine and also while learning medicine, I have found that there's a huge shortage of good teachers in the medical industry. And when I started practicing and when I started playing some lead roles in hospital, in the emergency rooms, within the hospital, I found that there is also a dearth of leadership. So I wanted to combine my passion of teaching and also take up some leadership roles within the medical education system. And Apollo gave me this great opportunity to lead their kind of an education vertical. So that's how I got here. And I've been enjoying this journey for last close to a decade now.
That's good to know, sir. So now just talking about the organization, how is Apollo Medskills, changing the healthcare landscape in India?
So if you see India with more than 1 billion population, and it requires an extensive healthcare infrastructure and a huge workforce of healthcare professionals to drive kind of healthcare systems in India. And all this beside, there's a spurt of new hospitals and medical facilities across the country. And if you look at the World Health Organization statistics, we're still way behind in getting adequate number of healthcare professionals. And as you see, India today, we would need about 27 lakh additional beds to meet the World Health Organization criteria and to meet the needs of Indian population. And how do we manage these beds? And if you look at managing the beds, each hospital bed would require 7 healthcare professionals to manage a bed. So when I say 7 healthcare professionals, it includes doctors, nurses, allied health professionals, lab technicians, the dialysis technicians, the pharmacists, healthcare managers. So each bed requiring 7 professionals. And you imagine we are adding about 100,000 beds, 1 lakh beds each year both in the public and private sectors in India. That means each year we would need about 7 to 7.5 lakh healthcare resources just to manage those beds.
Yeah.
So there is a shortage of healthcare workforce across the sectors, be it doctors, nurses, allied health workforce. And in order to address this shortage of healthcare practitioners, Apollo has actually collaborated with National Skill Development Corporation in 2012, and we started Apollo Medskills then. And one of our primary goals is to train quality healthcare workforce for India and for the world. So we are not just part of Skill India, but we are also skilling India for the world. So indirectly, we are part of the Make in India movement, not in terms of product, but in terms of healthcare resources. So we are making actually healthcare resources in India and actually also exporting them to the world. So the shortage of healthcare practitioners, if you look at the shortage of healthcare practitioners, the biggest challenge is in the rural area. So there's a huge urban-rural divide in terms of healthcare manpower deployment in India. So, to just address this challenge, now Apollo Medskills is aligned with the Government of India's Skill India mission, and we are leading the skilling revolution in healthcare sector since our inception. To add a few more facts to this, how Apollo Medskills is helping this sector. Okay, if you look at various sectors that are undergoing change today, most of the sectors are becoming automated. So their human resource needs are coming down, in fact. But it's a known fact that the automation in healthcare sector is the least. You continue to need human resources in healthcare. You should have human resources for that touch, for that empathy in healthcare. So we have mastered this area by designing and building skill development programs for the young aspirants who are actually looking for livelihood opportunities within the healthcare industry. So to summarize your answer to your question, so Apollo Medskills is actually impacting healthcare landscape in 3 ways. First, we are improving the learning outcomes. We are addressing the shortage of skills in the healthcare sector in India. The second, indirectly, we are impacting the economic outcomes because we are providing employment to the unemployed youth by skilling them in healthcare. And we are also enabling the hospitals to manage those beds by providing healthcare manpower. So there is an economic outcome coming out of our learning outcomes or skilling. The third outcome is clinical outcomes. So if you see, a quality training will result in a qualitative outcomes within the clinical area. So the dialysis technicians trained with us will do the best dialysis that they can do for the patient. So you're saving lives. The emergency medical technicians who are trained with us, who are manning ambulances across India, and they're providing the best care. When there's a road traffic accident and you need to reach by ambulance, they're trained by us. So they provide the best care. Here, competence is very critical. So skilling them in the right way is super critical for us to provide the best outcomes. So that's how we are impacting, Kamini.
Thank you, sir. That was a very insightful response. Talking about the partnerships that you mentioned, that you've partnered with the NSDC in India, what are certain global organizations that Medskills has partnered with to implement and enhance their skilling program?
Excellent. So if you see, I have mentioned about the India shortages, like there's a need for about 7.2 million healthcare professionals in the next 10 years. If you look at the global shortages, there's a shortage of about 80 million healthcare resources. That's the requirement projected by World Health Organizations in the next 10 years. So 80 million is a significant and large number. And if you divide the world into the nations that are supplying healthcare workforce and the nations that have demand, and India stands one of the largest suppliers of healthcare workforce in the world. If you see whether it is National Health Services UK or Australia or United States of America or across the world, if you see, there's a significant proportion of Indian doctors and nurses contributing to their healthcare, not just in India, but across the world. So Apollo Medskills already have formed some good partnerships. In 2017, we are partnered with National Health Services, Health Education England, a kind of a training and a recruitment arm of healthcare resources in UK. We started training nurses on a very specially designed program by them called Earn, Learn, Return. So one of the challenges that UK had in taking resources from India is India itself has a huge shortage of healthcare workforce. How can we actually take resources? So they've designed a very beautiful program called Earn, Learn, and Return. So the nurses who are trained in India, we developed a specialized program to actually give them training in language, in culture, and also the clinical protocols in UK. And we are also partnered strongly with some of the Middle Eastern countries for supply of healthcare workforce. We are also partnered, not just this, we are partnered with some of the universities in UK, Australia, for some twinning education programs. These are some of our international partnerships, but we are exploring more. For example, yesterday we have launched a program with a German industrial body called GIZ. With them, we have started a program called Industrial Health Worker. Industrial health workers are the people who actually ensure safety and kind of safe health practices in the work environment. So in order to reboot or restart post-COVID, you need some strong training and create this breed of new professionals called industrial health workers who will actually ensure safe work environments in micro, medium, and small enterprises. So these are some of the partnerships.
I think it's great how much knowledge sharing is happening at a global level when it comes to healthcare. And I think that is really the way forward within the healthcare sector. Now, sir, it's almost impossible to have a healthcare conversation without mentioning COVID, right? So in light of, the pandemic that we are in, what are the changes and opportunities that exist within the healthcare industry? And especially how is Medskills gearing up for that change?
Oh, there has been complete revamp of healthcare, I must say. So we have seen an unprecedented demand for specialized resources, healthcare resources. You have seen that, there's a shortage of healthcare resources, and there was also at the same time, there's a need for rapid upskilling and reskilling of healthcare resources as well. So I will tell you some of the demand areas where we found there's a rapid rise in the demand.
Yeah.
There was a rapid rise in about 5 or 6 healthcare trades. These are the phlebotomy technicians. Phlebotomy technicians are the professionals actually who collect blood samples for doing testing. So with COVID-19 pandemic, we have seen a rapid rise in community testing. In the last 3 months, we have seen that there's a need for rapid community testing. And you need a healthcare professional who will collect the sample. And these people are called phlebotomy technicians. So we have trained close to about 60,000 phlebotomy technicians over the last 5-6 years. So we had to remobilize all of them and put them on jobs. Then there is a rapid rise in demand for medical lab technicians who actually conduct tests. So someone collects samples and get them to the lab, and someone has to perform these tests under the supervision of the laboratory medicine consultants like medical microbiologists and pathologists and biochemists. So these are the medical lab technicians, assist them and conduct these tests. So there was a rapid rise in the demand for them. Similarly, in rural India for dispensing medicines, there was a large kind of rise of demand for pharmacy assistants, so who actually dispense medicines during this time. And if you have seen the adoption of technology in healthcare has also rapidly risen during this time. And, telemedicine has become a new hero, like overnight hero. Telemedicine or teleconsultations were existing for last 2 decades. But there was not much adoption both by the patients as well as the healthcare professionals of telemedicine. But now there's a rapid rise in the teleconsultations. Just to give an example of Apollo Hospital itself, we had close to 200 to 250 teleconsultations each day before COVID. And now the teleconsultation volume has gone beyond 4,000 each day. Wow. It has grown by leaps and bounds. And not just Apollo, I think across India, I think telemedicine has become a new way of consulting doctors. So there's a new breed of professionals called telehealth consultants or telecoordinators who can assist the rural kind of population to consult a doctor, and also even the urban population to consult a doctor who's sitting in a clinic. So telehealth coordinators had a huge demand. The next large demand existed in this area called geriatric aids and home health aids. You see, there was almost the geriatric population mobility has been paralyzed. So all the people, all the population above 60 years have been asked to stay at home for their safety, and any healthcare demand that they had, so we had to address that at home. So we have this support service workers called home health aides and geriatric aides. Now the care is delivered at their home. Suppose if a patient has got a kind of post-hospitalization need of care need, then we supplied a large number of home health aides and geriatric aides to various companies, not just Apollo, but for our competition like Fortia Healthcare, Nightingale Healthcare. Most of them have hired these resources from us.
Okay.
And these are the demand that we have seen. And apart from this demand, one of the challenges that COVID has presented, most of the healthcare industry across the globe was unprepared for this kind of a challenge. So most of the doctors, nurses, they didn't had specific skill sets. For example, most of the doctors doesn't know, and nurses doesn't know how to use a ventilator. So we had to upskill these professionals on certain specific skills in pandemic management, in public health, in acute critical care skills, in emergency skills, like, as I told you, use of ventilator and how to triage a patient. Like, there's a huge surge of patients to the hospital. How do you separate a patient of a COVID and a non-COVID patient? How do you keep a non-COVID patient safe in a hospital? So these are some of the public health and critical care skills. So we did a rapid upskilling through e-learning. For example, the e-learning program, we launched one of the first e-learning programs for creating awareness on prevention of COVID. So there was a huge uptake. 180,000 people have actually logged in and took a certificate. They have completed this program and took certificate in the first 1.5 months. So that was it was a kind of a rapid scale thanks to technology. Similarly, we took the e-learning route to train the doctors, nurses, and paramedics.
Yeah.
So, yeah, that's how we have actually, adjusted ourselves to during this COVID.
That's very informative, sir. Now, whatever changes are occurring in the healthcare sector, that is by default, bound to have an impact on the education in these, medical colleges. So, how do you see the medicine curriculum in India changing and adapting to this new normal that we are living in?
The medical curriculum has to see some definitive changes in the way we teach them, particularly in view of pandemic. I think every medicine student, every medico and every nursing student has to learn the principles of healthcare disaster management. Healthcare disaster management was never a part of curricula of medical education. Now I think pandemic management and healthcare disaster management are going to be a part of the curricula. The second area is public health. Though we have a subject called community health, community medicine, social and preventive medicine, but I think the aspects of public health and aspects of global health have to be incorporated into the medical curricula. This aspect is very important because if you see, you must have followed news that Cuba had sent a lot of doctors from Cuba to Italy, Cuba to Spain during this pandemic, during this crisis. So there will be a rapid redeployment of healthcare resources across the globe during the healthcare disasters, and we need to be prepared for that. So every doctor, young doctor who is getting trained, he should be trained on these principles of global health and public health. And third area, as I mentioned earlier, the public health and the critical care and emergency care skills are required for every medico and a nurse. If there is a national emergency, if there's an international emergency, they should really rise up to the occasion. They should get deployed any part of the world. Maybe if there's a health emergency in India, we should be able to deploy doctors from UK. We should be able to deploy doctors from Sri Lanka, from Nepal, anywhere, any part of the world. And similarly, we should be able to service any country in the world when there is a healthcare pandemic. that should be our goal going forward.
I think you're absolutely right, sir, because the pandemic has revealed almost gaping holes in, the healthcare infrastructure and education that exists, globally. And it's definitely a time for us to learn and prepare for, the next global health crisis, whenever that may be.
Absolutely.
Now, sir, talking about this whole e-learning and digital movement, with COVID has literally thrown us into this arena. Do you really think that the nuances of a doctor and that bedside manner, something like that can truly be leveraged through a teleconsultation or telemedicine?
Can that be fully leveraged? Not. But what are the aspects that telemedicine would cover? For example, if a patient who is actually in remote parts of India, say someone is sitting in, say I'm from Telangana, so I will take an example of, say, in a remote village of Karimnagar, and he has to suddenly consult a gastroenterologist or a senior consultant, a super specialist for a severe gastritis in the midnight. He cannot go to a hospital because of the COVID crisis. There's a lockdown. The only way that is available is through teleconsultation. So what are the limitations of teleconsultation? There are a lot of advantages, but there are certain limitations. For example, if someone has got pain abdomen, how do you diagnose whether it is an acute appendicitis or a kidney stone? Just by symptoms. You need to touch the patient. You need to do a palpitation. You need to percuss the patient. There are a lot of, by touch, there are a lot of things that you need to examine a patient, which cannot be done by telemedicine. Yeah. But yes, a lot of panic is avoided. A lot of patients who got common cold thought that they have got COVID. And they could have gone into depression. They could have gone into another mental illness because of that. This was rapidly avoided by telemedicine. It has really helped people on time for an on-time consultation and removing the fears from their mind.
All right, sir. So now we've spoken about challenges and opportunities that exist within the healthcare sector. Now, specifically talking about Apollo Medskills, what's in store for the future?
Oh, we had a rapid change of our business plans. So now what we have done is we have got changes in every aspect of our business. Okay, so right from the way we do sales to the way we execute our projects to where we place our students. When I say where we do our sales, you see there are opportunities everywhere as we see now. Like as I just mentioned, we are doing training for school health coordinators. Now, schools are also uncertain. When do they open? So for them to open, they need to know certain protocols, what exists, right? So many schools have approached us that they need to train their school health safety coordinators. So this is something that we never imagined, that we would do such training for some teachers and facility managers of the schools on how to manage the school environments post-COVID. So this is something that has come up, thrown up to us, and we have built a strong curriculum, and we are also delivering training for some of the schools in India. Similarly, the industrial bodies have approached us. As I just mentioned, the GIZ from Germany and the MSME ministry have approached us to train the Ministry of the Medium and Micro and Small Enterprises on how to reboot or restart their industries. Similarly, we got requests from a lot of healthcare institutions to train their healthcare resources on, say, the emerging changes in healthcare, like ventilator management and stress management for healthcare workforce and so on. So there are varied training requests coming from all sorts of people, which we never had. That's in the sales side. In the execution side, you see student engagement in a classroom, which accommodates 30, will rapidly change now. I think we really need to work on 2 or 3 models now. Going forward, e-learning is going to play a very, very critical role. So we have already started engaging our students on e-learning. And the second major change on the training, possibly we will be using a lot of medical simulation instead of a direct hospital exposure. When I say medical simulation, we will create hospital environments in laboratories We will create a scenario of a chest pain patient coming into a hospital in our medical simulation lab, rather than taking them and directly exposing them in an emergency room. So there will be a lot of medical simulation integration, not just environment simulation, but when we train phlebotomy technicians now, the one who collect the blood samples, what we are doing is now we are giving them a phlebotomy arm, which is an artificial arm. So it has a similar venous pattern as a human arm. So when they insert a needle, they will find a similar kind of a tactile sensation of the kind of a vein, and they will have a same depth of the skin when they insert a needle. And we also pass some fluid which looks similar to blood. So when they withdraw the fluid, they get a sense that they're actually withdrawing a kind of blood from the vein. So with that experience, a simulated experience, they'll be better equipped to go and work in a hospital rather than directly deploying them in the hospital, because the safety measures that we need to take care, we should take for our students. So medical simulation is going to play a big role along with e-learning. And third, the hospital exposure also we will be doing with under a high safety precaution now, the on-job training that we are going to provide to our students. At the training level, these are the changes that we would see. When we place our students, I would say that in the last 3 months, whatever student inventory, leftover inventory we had, we could place most of them on the jobs. Though we are in a very paradoxical situation that we have plenty of jobs in our hand, but all our students are now exhausted. So now we need to train a lot of resources. So we are looking at ways of training them through e-learning, blended learning programs. So we have collaborated with universities during this lockdown time. So recently we have launched a healthcare management program with Hyderabad Central University and also with ICFI University. So because there's a huge demand for healthcare managers as well in the hospitals. So a lot of changes all around, and we are taking utmost precautions to ensure safety of our students. At the same time, we know that we need a scale in healthcare, so we cannot stop our training. We will continue to do that in safe environments and in the best way, not compromising on the quality of the training.
That's wonderful, sir. Now, just to end our interview with a simple message, so many of our healthcare workers have been fighting on the front line for months, and I'm sure many of your trained students are, standing in the front line as well. So what is the message that you have for our healthcare workers who are working day and night to ensure that our health is safe?
So first of all, I think my heartfelt thanks and a big salute to all the healthcare workers who are on the front line. And I think they are definitely protecting the nation with their white coats. The message that I want to give to each one of you is please protect yourselves and your families. And you are highly resilient. I think this is a time that you have shown your highest resilience. Keep up that, and ensure that you are keeping your immunities high. So eat well on time. I know the duties, sometimes you need to overstretch. So eat well, keep your immunity high. And more importantly, coming from an education CEO, though I'm a doctor myself, you upskill yourself. Because as doctors, as nurses, as allied health professionals, there are definitely some things we don't know. So please follow the news, the global news, upskill yourself, see the latest trends in the treatment. And it's very critical because it's a very dynamic, COVID is a very uncertain kind of a disease, and we don't know the concrete treatments yet. So it is very important for us to upskill ourselves and then be updated with the latest trends of the treatment and the protocols. And again, salute to all of you. Thank you.
Thank you, sir. Thank you for that personal message. This brings us to the end of our interview. Thank you, Doctor, for such an insightful and intriguing conversation. And I'm sure all our viewers are looking to a leader like Apollo Medskills and a leader such as yourself to see what the much needed changes in healthcare are going to be.
Thank you. Thank you, Yamini. I have really enjoyed the conversation with you and very pertinent questions. It's quite engaging. And I would like to thank CSR Box for giving me this opportunity to interact with everyone who is actually looking forward to enter into skill development area and also particularly into healthcare. Thank you.
Thank you, sir. Thank you for being here.